The preoperative suite at Cedars-Sinai Medical Center felt like a tomb as I lay on the gurney, staring at the fluorescent lights that would be among the last things I'd see before my emergency spinal tumor removal. At 27, I'd grown accustomed to my family's casual dismissal of my health issues, but their complete absence from today's life-threatening procedure felt like the ultimate abandonment. "Where's your family, honey?" asked Maria, my pre-op nurse, adjusting my foreline with practiced gentleness. Dr. Williams usually likes to speak with immediate family before major neurosurgical procedures. I managed a weak smile despite the pre-medication making me drowsy. They had something more important to attend to. Maria's eyebrows furrowed with concern, but she was too professional to press further. What she didn't know was that my parents, both respected physicians at this very hospital, had chosen to skip my surgery to attend my sister Caroline's wedding rehearsal dinner, an event that could have easily been rescheduled or attended by one parent. "Your operation can wait," Mom had said dismissively yesterday while reviewing seating charts for the reception. "Caroline's wedding is a once-in-a-lifetime event. The tumor has been there for months. A few more days won't matter. A few more days might kill me," according to the neurological team that had been monitoring my progressive symptoms for weeks. But in Mom's medical opinion, my spinal cord compression was less urgent than ensuring the wedding flowers matched the bridesmaids' dresses. Dad had been equally dismissive during his morning rounds. "The wedding is Caroline's special day," he'd explained to his residents, as if my potential paralysis was a minor inconvenience compared to his daughter's social event. Family celebrations require everyone's participation. What made their absence particularly galling was how they'd positioned themselves as the devoted medical parents whose daughters had both chosen healthcare careers. Caroline was the golden child, Harvard Medical School graduate, chief surgery resident, future orthopedic surgeon following in Dad's footsteps. I was the disappointing daughter who'd chosen alternative medicine as a physical therapist, someone whose career seemed insignificant compared to Caroline's surgical ambitions. The irony was exquisite. While my parents attended champagne toasts and rehearsal dinners, I was about to undergo surgery performed by Dr. Sarah Williams, the chief of neurosurgery and Mom's direct supervisor. The same Dr. Williams who'd been trying to reach my parents for 3 days to discuss the surgical risks and postoperative care requirements. "Dr. Williams will be with you shortly," Maria said, checking my monitors one final time. "She's one of the best spinal surgeons in the country. You're in excellent hands." I nodded, closing my eyes against the harsh lighting. What my family didn't realize was that their casual dismissal of my surgery was about to become very public knowledge among the hospital's most influential physicians. Dr. Williams had built her reputation on surgical excellence and professional accountability, principles that didn't align with skipping your daughter's emergency surgery for wedding festivities. The preoperative anxiety was nothing compared to the anticipation of what would happen when Los Angeles's most respected neurosurgeon learned that 2 of her physicians had prioritized party planning over their daughter's spinal cord compression. "Has anyone been able to reach Dr. and Dr. Martinez?" I heard Dr. Williams ask someone outside my curtained area. "No, ma'am. They're not answering pages or phone calls. The daughter says they're at a wedding." There was a long pause before Dr. Williams responded. "A wedding. While their daughter undergoes emergency spinal decompression." Her tone carried the professional displeasure that had made her legendary in medical circles. "Tomorrow's surgery would save my life, but tonight's wedding would destroy theirs." The surgery took 8 hours. When I woke in the neurological ICU, tubes and monitors surrounded me like electronic guardians, each beep confirming that the tumor removal had been successful and my spinal cord remained intact. The pain was manageable, but the solitude was crushing. No flowers, no worried family members, no indication that anyone cared whether I'd survived the procedure. My phone showed 23 missed calls from Caroline, but nothing from my parents. The calls had started around midnight, shortly after Dr. Williams would have finished my surgery and attempted to provide the postoperative update that protocol required her to give my next of kin. "Mia." Caroline's voice was tight with panic when I finally called her back. "Oh God, are you okay? Dr. Williams has been trying to reach Mom and Dad all night." She sounded really angry. "I'm alive," I said, my voice hoarse from the breathing tube. "Surgery went perfectly. No paralysis, full mobility expected." "Where were Mom and Dad?" Dr. Williams said they weren't answering emergency pages during your operation. I almost laughed, but it hurt too much. They were at your rehearsal dinner, then probably your after-party. You know, handling the really important medical emergencies. The silence on Caroline's end spoke volumes. She was brilliant, top of her medical school class, published researcher, future surgeon, but she'd somehow remained blind to our family's toxic prioritization. In her world, our parents were dedicated healers who'd inspired both daughters' medical careers. She'd never seen how they treated the daughter whose achievements didn't reflect their surgical ambitions. Mia, they wouldn't. Caroline's voice trailed off as she processed the implications. They've been planning your wedding for 6 months. Mom told her colleagues my surgery was routine and could wait. Dad explained to residents that family celebrations take precedence over elective procedures. But it's spinal surgery. You could have been paralyzed. Apparently that was less important than making sure your centerpieces were perfectly arranged. Over the next few days, as I recovered in my private room, the hospital's professional network provided entertainment better than cable television. Dr. Williams, it seemed, was systematically documenting every instance of medical negligence she could connect to my parents' absence from my surgery. The neurosurgical director was legendary for her intolerance of physicians who prioritized personal interests over patient care, even when the patients were their own children. She'd built her career on medical excellence and professional standards, principles that apparently didn't align with attending wedding parties while your daughter underwent emergency spinal decompression. Mom finally appeared on day 2, looking harried and defensive in her wrinkled wedding attire. Mia, darling, I'm so sorry I couldn't be here. The wedding required my full attention, and you know how important family celebrations are. The explanation might have been believable if her full attention hadn't been documented in dozens of wedding photos posted on social media, showing her dancing and celebrating while her daughter's spinal cord was being surgically decompressed. Dr. Williams wants to speak with both you and Dad, I said, watching Mom's face pale beneath her makeup. Yes, well, there was a miscommunication about the surgical timing. These scheduling conflicts happen in medicine. These conflicts didn't usually result in the chief of neurosurgery requesting formal meetings with attending physicians about professional conduct, but I didn't mention that detail. Tomorrow's departmental review would provide enough surprises. Dad visited that evening, still wearing his wedding tuxedo, his usual confidence noticeably diminished. Mia, I hope you understand that family obligations sometimes conflict with medical schedules. Caroline's wedding represented years of planning and couldn't be postponed. So does surviving spinal surgery, but apparently that was more flexible in your medical opinion. His jaw tightened. Don't be dramatic. The surgery was successful, you're recovering well, and everything worked out fine. Everything would work out fine, just not in the way he expected. Dr. Williams' reputation for holding physicians accountable was about to provide an educational experience for everyone involved. The wedding was beautiful, by the way, Dad added, as if sharing details about the celebration they'd prioritized over my surgery would somehow justify their choice. I'm sure Caroline looked lovely. Too bad I couldn't attend, I was having my spine operated on. The sarcasm was lost on him, but tomorrow's ethics review would clarify exactly which family events truly required medical attention. The monthly ethics review at Cedars-Sinai's neurosurgical department was typically a routine affair. Case studies, protocol updates, administrative announcements that interested only the physicians required to attend. This Thursday's meeting, however, promised to be significantly more memorable. I'd been discharged that morning with strict instructions for spinal rehabilitation and follow-up appointments. My recovery was progressing excellently, thanks to Dr. Williams' surgical expertise and the dedicated nursing staff who'd provided the family support my actual family had neglected to offer. What my parents didn't know was that Dr. Williams had invited me to observe today's meeting from the medical student gallery. I think you'll find the case presentation particularly relevant to your physical therapy background, she'd said with a smile that promised professional justice. The conference room filled with Los Angeles's most prestigious neurosurgeons, department heads and senior attending physicians. Mom and Dad sat near the front, their confidence intact as they discussed upcoming medical conferences and research publications with colleagues who didn't yet know the complete story. Dr. Williams called the meeting to order with her characteristic precision. Today's primary agenda involves a case study in medical ethics and family responsibility that requires our immediate attention. The room's energy shifted as physicians recognized the serious tone. Ethics presentations usually meant someone's professional conduct was about to be examined for educational purposes. Last Tuesday, I performed emergency spinal tumor removal on a 27-year-old patient with progressive neurological symptoms and imminent risk of permanent paralysis. The patient's condition required immediate surgical intervention to prevent irreversible spinal cord damage. Medical slides appeared on the presentation screen. My preoperative imaging, surgical notes, postoperative recovery data. A textbook case of successful neurosurgical intervention that would normally warrant brief discussion and congratulations. The patient's parents are both attending physicians at this hospital. Dr. Elena Martinez from Internal Medicine and Dr. Robert Martinez from Orthopedic Surgery. I watched Mom's face drain of color as she realized where this presentation was heading. Despite multiple attempts to contact the patient's next of kin before, during and after this life-threatening procedure, both physicians were completely unavailable. Emergency pages, phone calls, and urgent communications went unanswered for over 10 hours. The room's attention focused on my parents like a surgical laser. In the medical community, being unreachable during your child's emergency surgery was professional suicide. Investigation revealed that both physicians were attending social functions related to their other daughter's wedding celebration, despite being informed that their daughter Mia required immediate spinal decompression to prevent permanent paralysis. Documentation appeared on screen: phone records, page logs, emergency contact attempts. Every failed communication time-stamped and verified. Dr. Elena Martinez informed colleagues that the surgery was routine and could be postponed for family celebrations. Dr. Robert Martinez explained to residents that wedding festivities take precedence over surgical schedules. The silence was deafening. Seasoned surgeons who'd witnessed every form of medical crisis were stunned by the casual negligence being documented. The patient, Ms. Mia Martinez, a licensed physical therapist specializing in spinal rehabilitation, underwent successful 8-hour surgery without family support, recovered in intensive care without parental presence, and spent 3 days in post-surgical care while her physician parents continued attending wedding celebrations. Dr. Williams' voice carried the cold precision that had made her legendary. This case represents a fundamental violation of both parental responsibility and professional medical ethics. Any physician who considers their child's emergency spinal surgery routine and prioritizes social events over life-threatening procedures has demonstrated complete unfitness for patient care. The presentation continued with evidence that would destroy both their careers. Recorded statements dismissing my surgery, social media documentation of their wedding attendance, testimony from colleagues who'd witnessed their unprofessional priorities. Effective immediately, I'm recommending both physicians for suspension pending formal ethics investigation. Additionally, I'm forwarding this case to the State Medical Board for review of professional misconduct and potential license revocation. My parents sat frozen as their colleagues absorbed the magnitude of their professional disgrace. In 2 minutes, Dr. Williams had ended 2 medical careers and destroyed their reputations among Los Angeles's most respected physicians. The aftermath was swift and merciless. Both medical licenses were suspended within the week, pending formal hearings that would determine whether Mom and Dad could ever practice medicine again. The hospital's ethics committee found their behavior so egregious that reinstatement seemed impossible. Caroline called that evening, her voice breaking with shock and confusion. "Mia, is it true? Did they really miss your surgery for my wedding?" "They didn't miss it, they chose not to attend. There's a significant difference between accidental absence and deliberate abandonment." The silence stretched as Caroline processed the implications. Her entire medical career had been inspired by parents she'd thought were dedicated healers. Learning that they'd prioritized her wedding over life-threatening surgery shattered more than just professional illusions. "I had no idea," she finally whispered. "If I'd known, you would have postponed the wedding," which is exactly what normal parents would have suggested when their daughter needed emergency spinal surgery. Within a month, the consequences were complete. Mom lost her position at Cedars-Sinai and found herself unemployable at any major medical institution. Dad's surgical privileges were revoked, ending a 25-year orthopedic career. Their medical colleagues who'd once respected their expertise now viewed them as cautionary tales about professional priorities. The financial implications were devastating. Without medical salaries, they couldn't maintain their lifestyle, country club memberships, or the expensive home that had hosted Caroline's wedding reception. The social standing they'd prioritized over my surgery evaporated along with their medical careers. Caroline postponed her honeymoon indefinitely, too devastated by the revelation to celebrate. The wedding they'd attended instead of my surgery had become a symbol of their fundamental failure as both parents and physicians. My recovery, meanwhile, continued excellently. Dr. Williams monitored my progress personally, and the spinal rehabilitation team provided support that went far beyond standard protocols. The hospital's physicians, horrified by my parents' behavior, ensured I received care that demonstrated what medical professionalism actually looked like. 6 months later, I received an offer to join Cedars-Sinai's rehabilitation department as a senior physical therapist, specializing in post-surgical spinal recovery. My work would help patients regain mobility after procedures like the one my parents had deemed less important than wedding celebrations. They still send occasional messages, usually around holidays, with awkward attempts at reconciliation that ignore the fundamental issue. They chose a social event over their daughter's potential paralysis, and no amount of regret can excuse that decision. Dr. Williams offered perhaps the best perspective during my final follow-up appointment. Mia, some people become physicians because they want to heal. Others become physicians because they want status and respect. Your parents confused medicine with social climbing, and that confusion destroyed their careers and family relationships. The spinal surgery was completely successful. Full mobility restored, no neurological deficits, complete recovery expected. But the most important healing was realizing that family members who prioritize parties over your survival don't deserve access to your life. Medical ethics exist for a reason. When physicians forget that every patient, including their own children, deserves their full professional attention, they lose the right to practice medicine. Sometimes the most important surgery removes toxic relationships along with dangerous tumors. Family celebrations are important, but they should never be more important than family survival. Anyone who can't understand that priority doesn't deserve to call themselves either a physician or a parent.